Sinus tachycardia. So sinus tach, or sinus tachycardia, is when the heart rate is functioning under sinus rhythm. However, the heart rate is greater than 100. So what is sinus rhythm? If you look at the conduction system of the heart, you see that the SA node, or the sinoatrial node, is the primary driving factor. And this is found at the atrium. That's where the A comes from, sinoatrial. And it's up at the top where it connects to the vena cava. Now, sinoatrial is where you get the S, sinus. That means that is the driving factor of the heart. Normally, that helps pace the heart between 60 and 100. However, with sinus tach, it's going to be greater than 100. Now, tach tells you it's going to be greater than. Tachycardia, increased heart rate. Tachypnea, increased respiratory rate. So if you see the word tach, that's going to be an increased amount. So besides being greater than 100, the way you know that it's sinus is you'll see that the atrial and ventricular rates are regular. And so what this is when you look at the EKG, the P waves and the QRS complexes are going to be the same. There's going to be an equal amount. You're not going to have extra atrial contractions or extra ventricular contractions. There's going to be 1-for-1 ratio. And they're going to also be, the distance between them is going to be consistent. You're not going to have periods where the heart's beating faster or where the atrium are beating faster, ventricle. They're going to be consistent each time. Now, what are some causes for sinus tachycardia? Increased cardiac demands. This could be due to exercise, for example. As you exercise, your heart rate increases, and your body's trying to compensate for your need for oxygen by increasing the heart rate. And as you can see here, decreasing oxygen saturations. This could be secondary to exercise, or it could be due to respiratory issues. If a patient is having respiratory troubles and their oxygen saturations are dropping, the heart's going to try to compensate by increasing the heart rate to pump the blood around quicker. Now, treatment for sinus tachycardia depends on the cause. If it is due to low oxygen levels, what you could do for a patient is give them some O2 therapy. If it's due to not enough blood supply, that's another cause, is hypovolemia. You can give them IV fluids. If it's due to anxiety, someone's anxious and so they have the adrenaline in their body, you can give them anti-anxiety medications. In some cases, you may need to give the patient medications, such as like beta blockers, which can actually temporarily medically decrease the heart rate. And the reason that you want to make sure you're not running sinus tach is the heart at this point, it can get to the point where it's beating faster than it can compensate for. And what happens is, as it's beating fast, the heart itself as a muscle is needing more oxygen. And if it's not able to supply its own oxygen well enough, it can lead to ischemia, angina, and eventually myocardial infarction, or the development of another dysrhythmia. So this is sinus tachycardia.